What I'm going to talk about today is the more internal part of chiropractic more than the external part. External part meaning the adjustment and the outcome and the symptoms. I'm going to go back to the beginning, bore you a little bit, and let you understand what we do as chiropractors, how we get to where we are, what we do, and how we do it. So here we go. It's made up of the science, art, and philosophy. The science is the founding principles of chiropractic, discovered by Dr. D.D. Palmer, discovered by removing the interference of a nerve in the body, causing pressure by a bone against that nerve. And that formation caused a decrease of function, and it didn't let the patient have its full action potential. So it was blocking or interfering in the body's communication. It's called the above, down, inside, out method. It's the main principle of how the body works. It starts from the brain, works its way down the spine, comes inside from the body to the outside. That's how the body works naturally. Anything you put on the outside in is not natural for your body. Your structure determines your function. So we're always looking at your structure to see how well your body is functioning. Of course, you'll tell us that when you come into the office. It's no different than your car not being aligned. It still runs. It's just not going to run efficiently. The art of the business is the technique a doctor will use when manipulating the body. There are many different types of styles of adjusting. Each doctor adopts a style adjusting to his or her likes. A good doctor will have many different styles because not everybody is the same and not everybody has the same symptom. You don't want to do a cookie cutter approach. What makes me a little bit different from other chiropractors is I like to do corrective care work versus pain relief work. We all do pain relief work, but the trick is trying to correct the problem if you can. If you cannot, you try to maintain it as your best as your ability. The philosophy in the business is the approach and the style with how a doctor handles their cases. The beliefs that the doctor acquires in their training helps mold his or her pattern of care. And I'll talk a little bit more about the philosophy in a second. The three components that keep the body at its optimal levels of optimal health is the balance of the triangle. It's called the physical and the chemical and emotional triangle. Just think of those as the three sides. Each one carries one side. One side carries the physical component, refers to the body, how one takes care of their body across the board. Being physical is important to the movement and the motion of the body. Exercise is probably one of the most important to do for the body, 3 to 4 times a week, 30 minutes at a time. Some will do more, which is fine. But at least that, like I've always said, at least walk, move. We sit way too much during 2020. We got to get back moving again. Stretching is equally important because it moves the ligaments and tendons along your muscles, which are attached to your skeleton. This is the number one thing most people don't do, stretch. If I could see you, I'd ask you to raise your hand, but I can't see you. All right, the next component is chemical. Obviously, that's anything that you can put in your body through food, drink, drugs, alcohol, medications. Remember, whatever you're putting into your body from the outside is not normal. So you need to try and work as much as you can to treat your body right by what you're putting into your body and taking care of it. And of course, drink your water. The emotional component is the mind or the psyche. That's where it all starts. It's what I call an ingrained belief. It's something that you were taught when you were growing up through your parents, your pastor, your school teachers, everything else. You start to get a belief system through that, and that's how your emotions work in your body. The mental health is super important, especially after what we've just gone through in the stresses of life. Enjoyable activities are a great stress reliever. Meditation and breathing exercises are also wonderful stress relievers. Try for 5 minutes a day and notice the difference. It's amazing. You don't have to do some kind of big blah, blah, blah. Just put yourself in a quiet area and relax for 5 minutes, let your brain go. You'll be amazed how you feel. The power of the adjustment is what we actually get to now. Getting adjusted increases the central nervous system function of the brain so it may relay messages to your body. The body is a self-healing mechanism. So what that means is if you cut your hand and you do nothing about it and it's bleeding, bandage it up, it will heal in a couple days. The body is very, very powerful. Not all tissues can resolve themselves, and that's where chiropractic comes in to help the healing process and restore normal function. Most people find out about chiropractic and adjustments through pain. Once a patient goes through that care, one realizes there's a lot more going on than just getting rid of pain. Increased stamina, clarity, better sleeping patterns, more energy are just a few of the benefits of getting adjusted. Who doesn't want that? So who needs adjusting? Babies, young playful children. They're always falling down. They're bumping themselves. Anyone in sports, slips, falls, motor vehicle accidents. There's many, many more ways. People just think that I don't need to get adjusted because my neck or back doesn't hurt. That's not the case. Hopefully through some of this little information, you can find out that your body is very powerful and works a lot more better. That's a good English. Oh, you're going to have to edit that one out, Sean. It works a lot better through the adjustment and how your body communicates to your body. What else can I do to get to be healthy? Action steps I can take. Posture, weight distribution, wallet for the guys. Get rid of it out of your back pocket. Your purse, which shoulder do you carry it on? Supplementations, vitamins, herbs, anything you can help supplement because we don't have the very best diet in the United States. Exercise and stretch and drink plenty of water, obviously, are key. If you know of someone who is suffering or complaining about their health or just wants to talk, we offer a no-charge consultation. Call today to change you or someone's health. I want to thank everyone from BGI for all your support. Sean, excuse me, you've been great. You've helped me get through this without even knowing how to turn on the computer. So I appreciate that.